To elaborate on that counterpoint, what is the kind of the current...
The counterpoint is that we're throwing money at more silos. We're just creating more little holes in the ground. That the Recovery Act money or the stimulus money that the government's putting forward for the adoption of the electronic health record has a much better place to be spent. I mean, we can be spending this money on secured clouds where we're publishing metadata, where we're creating event data and we're bringing that together, indexing it, keeping things where they are, but providing an understanding of where things reside. Sort of the Amazon approach to, Amazon doesn't have any books, but they know where every book resides. So we have to think of this thing differently. A little bit more of a cloud technology, but I hate using that word cloud. Cloud is completely overused, but we got to look at the cloud as that sort of that aggregating space, not to aggregate data, but event data. And then clinicians have the ability to look along timelines that are indexed to the cloud and decide what they want to see from a data perspective. And we can do that. It's available today, but we've got to change our mindset. There's a lot of talking, in the rooms with the cigars and stuff. People are saying this isn't making a lot of sense, but the money is being spent in a certain direction. I really believe that people are starting to come around. They're starting to say, hey, the emperor has no clothes. Something's not right here, and we've got to come up with a different solution. So whether or not they're willing to say it on camera or willing to say it in Washington, there's definitely an underpinning, kind of a counterculture of, is this really the way that we want to go in healthcare? It's really hard to run opposite of the green glue. If you're selling a widget, you're going to go ahead and genuflect, or you're going to move forward with the mantra that is pushing things forward. It's a market thing. If you have shareholders that you have to answer to, you're going to push whatever the money's going to give, whatever it's going to bring. But I think our providers down on the ground, those that are actually delivering care, they're concerned. I think there's a different approach to the way they want to think about how do we deliver health care.
Catch the premiere issue of Hit Exchange magazine or visit hitexchangemedia.com for more healthcare technology news and information.